Hello, this is Dr. Ilter Denizoglu from Turkey, doctorVOX. I'd like to present you 3 different devices for application of Lax Vox voice therapy technique. The first one is the classical one. This is a silicone tube which was devised by Marketa Sihvo. After taking it out from its sterilized package, then you can use the silicone tube, the Lax Vox tube, in a half-liter drinking water bottle, put it into it, and Lax Vox. The second device is a new one, which we named as pocketVOX. pocketVOX has 2 openings, one for phonation, one for inhalation. You can also use the same bottle which you used in Lax Vox tube and put the longer tube in and turn the cap and fix it. Then you have 2 plugs in both sides of the tube. Take the plugs out and it's ready to use. The longer one has some lines and some abbreviations here. These are for personalizing your device for yourself. For example, for children, you can cut it from the first line, for sopranos and tenors from the second, and for mezzos and baritones from the third. You do not cut if you are a bass or an alto. So you Lax Vox into the tube, you phonate into the tube like and if you want to humidify your vocal folds, you can inhale the humid air inside the bottle like when not in use, you can put the plugs on its place and water cannot be spilled out when you put the plugs inside. The third and the most complicated Lax Vox device is the doctorVOX. doctorVOX comes with its built-in box bag, and in the bag you can find some accessories like a thermos wrap, the mouthpiece, the clips, neck lanyard, and the tip tuner. You can use it hands-free. You can phonate in and inhale from the other side. So these 3 devices are the devices that you can use during the applications of Lax Vox voice therapy technique. Lax Vox voice therapy technique, which we call it LVVT, is a direct technique which directly changes vocal mechanism. It is a holistic approach combining phonation, resonance, and breathing in voice therapy. Artificially elongated vocal tract and back pressure, which is continuous and alternative, are the main physical factors which intuitively balance the several simultaneous functions included in voice production. various devices, Lax Vox tube, pocketVOX, or doctorVOX, provide multi-channel biofeedback and enhance treatment adherence in LVVT applications. LVVT is not simply the practice of phonating into tube dipped in a certain amount of water. It is a multidimensional, multi-level treatment strategy and an integrative approach for a given voice patient. 3 levels of Lax Vox voice therapy survey are distinguished through practice: clinician's action plan, exercise patterns, and the patient's motor learning state. LVVT has a dynamic algorithm. There are no exercise templates which fits for all. The clinician has an action plan, and there are various predefined exercises, and the clinician can choose any exercise for an individual patient. Exercise is not the goal. It is a tool. The whole process of Lax Vox is programmed according to the patient's motor learning state. For a given voice patient, the problem to be solved in this early stage is understanding what to do, how to do, and why it happened. The information of the nature of the pathology for a given case, an hourglass-shaped glottal closure, let's say, why and how it is supposed to be solved, what to do, how to do the task, the vocal exercise, safely and correctly, and the expected goals or purpose are important factors. The patients should also learn what it feels like to phonate correctly, and often their attention needs a lot of concentration in this phase, especially because phonation is mainly monitored by auditory feedback. Relaxation is important because in order to provide a proper posture and breathing during exercise, it is mandatory to relax the muscles which interfere, especially with the extrinsic laryngeal muscles. Relaxing is not a slouched state. It is a balance between the muscles, or it is like resetting to the factory settings. Consciously relaxing the shoulders, neck, and jaw will help a lot. Let's do it together. So first, try to relax your shoulders. Then your jaw. Take your cheeks and your palms and right. Feel your face relaxed. Yes. Posture with some very brief practical instructions. It's possible to provide a better posture in a short time. It is not easy to deal with a bad posture. But in Lax Vox voice therapy technique, we just start to have a better posture with instructions of the noble posture. The noble posture is standing or sitting like a prince or princess. In this, there are some specific factors. The first one is having your upper chest, which we try to make the patient to understand the sternum, the breastbone, high. But this should not let the shoulders constricted like this. So just relax your shoulders and your upper chest high. Now, there's another tricky point for the posture. We call it tail up. Just imagine you have a tail and you make the tail up position, which provides you a dynamic vertebral column. Breathing is also a tough task to deal with. The philosophy of breathing instructions is, in fact, relaxing the secondary breathing muscles and redirecting the effort from upper chest and shoulders to lower chest and the abdomen. So you can do it in front of a mirror. In this step, blowing into tube without phonation provides breath monitorization by controlling the bubbling. Let's do it together. So, try to bubble the water like that and keep your princess posture. Right. Just focus on bubbling. What do you feel during bubbling? And try to make a stable bubbling rate, and don't do. Just try to make it stable, like from the beginning to the end. So this whole pattern that we make in the beginning of the voice therapy is the preset step of Lax Vox voice therapy technique. The second step of Lax Vox voice therapy is the exploration step. In the preset step, we do the counseling, we do relaxation, we do posture and breathing issues. The second step is the starting of working about phonation. The second step of Lax Vox voice therapy technique is the exploration step. The door to reach the target vocal behavior is to provide maximum economy and safety to the vocal production. This step, the exploration, is dedicated to find a reflexive voice, which is defined as primal sound in vocal pedagogy. This vocal pattern can be achieved by some probing therapy techniques using forced adduction. Please do renting. It is exaggerated articulation. Please count to 10 like 1, 2, 3.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Great. And trills. Chewing approach. Yum, 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 yum.
Yum, yum, yum.
Yawn and sigh. Or pitch glide. From up. Ooh. It's also possible to use the sounds made instinctively, such as coughing, laughing, moaning, humming, etc. The primal sound is supposed to be a neutral vowel, which is called schwa in IPA, which does not relate with the linguistic brain activities. The third step of Lax Vox voice therapy technique is the development. It's a kind of vocal muscle building. Once a primal sound is achieved in the second step, in the exploration step, it is time to develop and stabilize that vocal pattern. The first step in this phase is to refine the primal sound. We can work on the glottal attack and glottal damping. Let's do it. For the glottal attack, you can see what's happening in the container, what's happening during bubbling. If you make a breathy attack, you first see the bubbling, then comes the voice. If it's too much blowing style, it is a hard glottal attack. Something like let's do with the breathing attack. Yes, this is the breathy attack. And let's do the hard attack. First hold it and then it's like an explosion in the larynx. So we exaggerate to be understood well. And then the balanced attack. The balanced attack means the bubbling, which shows your transglottal airflow, and the voice starts at the same time simultaneously, like just imagine that there is a small H in the who, not in the beginning of the, not like who, but like who. Yeah, could you please? During this phase, you can palpate the submental suprahyoid part of the neck and make the patient not to contract all of these muscles there, like that. Basic exercises are the muscle development exercises. They can be pitch-based exercises or loudness-based exercises. For the pitch-based exercises, we can count sostenuto, glissando, portamento, portato, staccato, and a specific one, legato. Let's start with the sostenuto exercise. The sostenuto exercise is sustaining the same tone at the same breath. Please. Just try to keep it stable from the beginning to the end. The second exercise is glissando. Glissando may be started from the high pitch or maybe from the low pitch. First from the high pitch. Okay, now start from the low pitch to the high. Okay. The portamento is again made at the same breath. So you take one breath and you use it at the whole exercise. For the portamento, there is very short glides between two tones, like into the water. In portato, there are no combinations like a glissando between two different tones, and there is a little H stop between two notes, like ha 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 ha. The bubbling continues during this exercise. In staccato exercise, the breath is paused between the tones. You can use it at the same tone, or you can use it in different tones, like ha 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 ha, or ha 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 ha, ha 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 ha, ha 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 ha. First at the same tone. Don't push, just try to make it stable. Ooh, 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 ooh. Now change the pitch. Ooh, 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 ooh. Loudness-based exercises is about changing in different loudness levels, like Loudness-based exercises can be stable or variable. Stable loudness-based exercises are exercising at the same level of loudness, like or variable, like crescendo and decrescendo. Please. First, the stable tones. Try to make a very piano sound. Now, try not to make too much bubbling and make the sound forte. Now let's do a crescendo. And decrescendo. Great. Then we can make combined exercises. We can combine these exercises, these basic exercises together with vocal play. For example, oh, 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 or oh, 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 or oh, 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 or oh. Let's do a glissando, then a sostenuto at the low pitches. Glissando starting from the high pitch and then to the sostenuto to the low pitches. Then a staccato and then a sostenuto. Then you can make some melodies with a single vowel, like all right. Then we try to make the linguistic load. Until now, we did not mention about any vowel, but a primal sound. But now we call it a specific or a certain vowel to be pronounced, like o or o or a or u, e. You can do it into the tube. Or wo, bu, bi, va. Just keeping the same vocal production manner without the device. First, to take the advantages, the physical advantages of the device, you can make different strategies. For example, you can do or you can take the clips out and you can do sequentially. Then do the syllable word sentence hierarchy like that. So let's do phonating into tube like 1, 2, 3, 4.
1, 2, 3, 4, 5.
Like that. Then you can read books aloud into the tube, and then, or newspapers, and do the same maneuver. And the end of the technique, Lax Vox voice therapy technique, is to transfer every muscle behavior to the conversation or to daily life. In the counseling step, we let the patient to see her vocal folds in action by stroboscopic recordings. You can also use some slides, some pictures, or you may draw by yourself. So these are your vocal folds, and there are 2 vocal folds here, and they open and close like that. And when you phonate, the vocal folds vibrate like this, like the lips, and they make sounds. But your vocal folds do not vibrate and impact totally, but in the middle. So you have little bumps in the middle of your vocal folds, but in voice therapy, as you see, but this is not so important and can be changed, can be corrected quickly. Let's relax now. Relax does not define a slouched posture. It is fit, not fixed. Please take your cheeks in your palms and slightly wipe your face and jaw down. Unload your shoulders now and let them hang down. Always upper chest is in the high position, but do not constrict any of your muscles. Now, the balance posture, standing or sitting high like a king, queen, or prince or princess, it is not a stiff position like a soldier. Breathing is a complicated task, but giving some simple instructions, we can also manage breathing in Lax Vox voice therapy technique. So, please breathe in as if you have lungs under your belly button. Under your belly button, right? Your lungs are under your belly button. Just try to fill them when you inhale. Yes. And now do the opposite. Exactly. Not from your shoulders and using your upper chest. Do not use your upper chest or shoulders. Imagine that you are blowing a candle but keeping it on fire. Try to keep your breastbone on place. Don't let it go down or sink in your chest. Another tricky point is do not close the airflow from your throat. Let it stay open all the time during breathing. So now breathe in, stop, Don't close it from your throat. Then breathe out. Exactly. So let's go bubbling without phonation. Bubbling rate is a good indicator of transcaloric airflow. So the patient can use it as a feedback tool and control the glottic resistance more easily. So first, hold the bottle close to your rib cage. Now, place the tube into your mouth between the incisor teeth and 1 centimeter of it above the tongue. Yeah. Then enclose the tube with the lips. Just elongate your lips like phonating oo to prevent air leak. So breathe in from your nose like in yawning or sniffing slightly. Now breathe out as you did at the previous session. Keep the noble posture and do not squeeze the upper chest into the water and try to monitor bubbling without phonation. Without phonation. Without phonation. Make the bubbling rate lower and lower. Exactly. Now make it higher. Exactly. So first you can bubble in a constant rate, then change the bubbling rate on will. By this way, you can see, hear, and monitor your breathing during consciously. Let's find the sound of target voice. So try to make a primal sound. For example, try to cough. So omit the first part of the cough. Omit the just tell Try to feel the first part, but do not make us hear that. Exactly. Again. Exactly. So just keeping that same pitch and the color of the sound, try to phonate into the tube. Ooh. Great. Again, please. Do not change anything in your throat. Just try to make the primal sound in the tube shortly without no meanings. Again. Take it out and do it again, the primal sound. Ha. Again. Into the tube. Out. Into. Exactly. So, bubbling with phonation goes with skill acquisition techniques. You can use various basic exercises such as Glissando, Sostenuto, Portamento, Portato exercises. Then you can combine them. Behavioral transfer is the last step, which we use the same vocal pattern and say some words. Please first phonate into tube and take the tube out and try to count from 1.
1, 2, 3, 4, 5, 6,
Exactly.
7,